Okay, welcome to today's presentation on dementia risk and chronic disease. Move to the next slide. Our learning objectives for this session consist of to discuss the concept of risk factors within the context of dementia, to discuss chronic conditions that increase the risk for cognitive impairment and dementia, and then also to utilize some of the data from the Louisiana Behavioral and Risk Factor Surveillance System, the Louisiana Report Card, and Americans' Health Rankings to help us identify health behaviors and chronic health conditions, especially that exist here in Louisiana, that can increase the risk of cognitive impairment and dementia. Next slide. So first of all, to begin the discussion, I thought it would be best to start with just the concept of risk factors. So we know that risk factors, more or less, these are conceptualized as characteristics that appear to have some degree of relationship to the development of a disease. But because a person has risk factors necessarily, it does not mean that the certainty that the disease will develop exists. And while we know that some risk factors are modifiable, which means that they can be changed or altered, we know that some cannot be changed, such as age, genetics, and family history. So if you see the little diagram in terms of what are the causes and risk factors of Alzheimer's, we know that the greatest risk factor for Alzheimer's dementia is really increasing age. And we know where those statistics, fall in terms of the actual 75, 85 and older, age group has the largest, prevalence or incidence for Alzheimer's disease. Another one is family history. So we know that in terms of if a person has a first degree relative, that could be a parent or a sibling with Alzheimer's, then they will be more likely, but not necessarily absolutely will develop Alzheimer's. And then of course, if they have more than one first degree relative, then that risk also increases. And then when we think about Down syndrome, the trisomy with Down syndromes, where individuals have an extra copy of a chromosome, 21, and that makes them, of course, more at risk for Alzheimer's, and they tend to develop it at a younger age. And then we know in terms of the role that genetic plays, we've had a previous discussion on this with the E4 gene, the APOE E4 gene. Individuals who have that gene, they're said to be more at risk for developing Alzheimer's disease. So those are factors that we can't change: age, family history, and genetics. We're going to spend some time talking today about the modifiable risk factors, and some of those could be examples would be, exercise, physical activity, diet, smoking. Those are all things that we can modify. And then also certain medical conditions as well. Next slide. So we talk about dementia risk and chronic disease. We know that the risk of developing dementia in later life can be influenced by many factors that are really present years before the actual symptoms start to manifest. And chronic conditions we know increase the risk of dementia. However, most persons with dementia have one or more chronic illnesses such as heart disease or diabetes, and these can also complicate care. So here's also a diagram that shows the percentage of people with Alzheimer's or another dementia who also have. You can see that hypertension is there at the top of the list with 73%, heart disease following, and then diabetes at 37%, kidney disease, congestive heart failure, COPD, stroke, and cancer. Next slide. These are also dementia risk factors, or the prevalence of dementia risk factors. And so we can see in terms of midlife hypertension. So not just hypertension, but midlife hypertension. And you see what that 40.3% midlife obesity, diabetes, smoking, and look at no physical activity, 49.3%, and that's a risk factor, of course, that's modifiable. Less than 6 hours of sleep, also at 10.8%. And then we know that some of the modifiable risk factors can also play a role, more or less, in terms of prevalence of some of the chronic diseases, such as diabetes and hypertension and cardiovascular disease. Next slide. So risk factors for cognitive decline in the United States. And we can see here that based on population level evidence, the 6 health conditions and behaviors included here increase the risk for cognitive impairments, and they may also increase the risk for dementia. And this data actually came from the behavioral risk factor surveillance system. So we can see the percent with at least one of 5 of these risk factors and what it looks like. And we can see in terms of the total would be 67.1%. And then what it looks like from a ethnic racial perspective with Blacks with 70, looks like 5.8, and then followed by Hispanic. And then you can see in terms of the white, 64.6, and then other. And then also the prevalence of these 6 risk factors for the midlife hypertension, and we'll talk about that more. And in this slide is conceptualized as ages between 45 and 64 years of age of physical activity. And you can see that percentage almost, well, 39.3. Midlife obesity again, age group 45 to 64, 39.1%. Diabetes, and then smoking, and poor sleep. And so we're going to also look at this within the context of what we know exists within the state of Louisiana. The next slide. So overall, and you may recall some of the slides from previous presentations, but if we look at some of the behaviors more or less with nutrition and physical activity and how we rank as a state, you can see that exercise, and that's the percent of adults, we rank 42, out of 50. Physical inactivity percent of adults, and that's at 45%. And look at sleep health, insufficient sleep, the percentage of adults. We rank 47th, and tobacco use, smoking, 43rd. And then health outcomes, physical health with multiple chronic conditions, percent of adults at 45%. And then look at obesity with the percent of adults, and that's at 49%, 49 at least in terms of our state rank. So we have very poor ratings in those areas. Next slide. So look at dementia risk and chronic disease, and this is a glance at the state of Louisiana and chronic disease. You see that we rank 49th in percentage of obese adults, 43rd with the diagnosis of cardiovascular disease, and then 44th with percentage of adults with diabetes. So we know that individuals with risk factors for cardiovascular disease, such as elevated BMI, high fasting glucose, elevated blood pressures in early adulthood, have a higher risk of cognitive impairment in later life. Next slide. So let's look at the Louisiana behavioral risk factor surveillance system. And I know in the past we took a look at the various counties within Louisiana and some of the health, problems, chronic health conditions. But when I really just kind of zeroed in on this, and you can see this is the 2022 conditions, risk factors, and percent prevalence for conditions such as diabetes, overweight, obesity, MI, everyday smoking, ex-smokers, never smokers, COPD, arthritis, depressive disorders, and kidney disease. But when I looked at it, I saw a trend within the Region 3. And Region 3 consists of St. James Parish, St. Mary, St. John, St. Charles, Assumption, Terrebonne, LaFourche, and Jefferson. So obese was the highest in Region 3, and so was kidney disease, stroke, cardiovascular disease, coronary artery disease, asthma, and COPD. So we wanted to really target more or less to do some targeted focus types of interventions. I think just having data like this would serve as a really good roadmap for us. So again, that's in Region 3. Next slide. And then high blood pressure by state. We can see in this slide is actually depicts the percent of adults who have who reported being told by a healthcare professional that they had high blood pressure, and you can see where we are in the dark blue in Louisiana, and some of our neighboring states are also with that's a greater than 36.7%. Next slide. So hypertension and dementia risk. We know that the prevalence of hypertension affects nearly half of US adults, and especially those that are 75 years of age and older. Randomized clinical trials have found that aggressive blood pressure control significantly reduced the risk of developing mild cognitive impairment. And that was in a really large study. It was called the SPRINT, Systolic Blood Pressure Intervention Trial. And it was found that they were actually placed into two groups. It was a randomized control trial. And so those that really had tight, you would call blood pressure control less than 120 millimeters of mercury, compared to those who had blood pressure control of less than 140 in terms of systolic. The ones that were in the less than 120 with a systolic showed like a 19% reduction in cognitive impairment and dementia. And then on average, less than 1/5 of adults with hypertension have their condition aggressively controlled. And that would be a blood pressure of less than 120 millimeters of mercury. Long-term research studies have shown that individuals with hypertension in midlife, again, 44 to 64 years of age, were more likely to develop dementia. And so that really points us to a targeted group of individuals for interventions. And then midlife vascular factors such as hypertension were associated with a 25-year incident dementia in the diverse atherosclerosis risk in communities. And that's called the ARIC observation cohort. And again, this was a longitudinal type of observational study that had over like 15,000 participants. And then in another study, the coronary artery disease, the risk development in young adults, called the Cardia study, cumulative blood pressure exposure over time. And again, that was starting in young adulthood, was associated with mobility and cognitive decline. So we know that vascular health and cognitive health are closely related. We know that what's good for the heart is also good for the brain. And chronic hypertension is actually viewed as the most prevalent risk factor for cognitive impairment in aging, and especially the midlife hypertension. And hypertension is also, of course, recognized as one of the strongest risk factors for stroke. So in the box, I have some additional comments. And actually, the research points to prevention as being the most effective means of changing the trajectory of hypertension. So there's strong scientific evidence for treating hypertension as an effective means for reducing the risk of cognitive dysfunction in older age. And we know that there are some disparities that exist in terms of access to treatments among certain underrepresented groups. Populations, which also tend to have a higher rate of hypertension and dementia. And then based on the link between chronic hypertension and ADRD incidence, and additional targeted population for prevention should include those middle-aged adults. Next slide. So here are some graphs, pictures more or less, that just show the age adjusted prevalence of persons diagnosed with diabetes in the US and other territories, and the percentage of self-reported physical inactivity among US adults greater than or equal to 18 years of age. So you can see in terms of where we are with the blue, in the blue area with a diabetes, and one of the states with the highest rates more or less of that. And then also looking at the other picture in terms of physical inactivity, you can see that the color that we are in that, and that also, represents the states with, highest reported physical inactivity among adults. Next slide. So we know that heart failure, atrial fibrillation, and coronary heart disease have also been linked to cognitive impairment. And this was an actual report published out by the American Heart Association, where previous studies had found that 14 to 81% of patients with heart failure experience some type of cognitive impairment. And then also evidence indicates that people with atrial fibrillation have a 39% increase of memory or thinking problems. Of course, they're also more prone to strokes. And adults with heart disease have a 27% higher risk of developing dementia, and up to 50% of individuals experience cognitive decline after a heart attack. So then managing heart health from an early age is important, not only for preventing heart disease, but also for protecting brain health and reducing the risk of cognitive impairment in later life. Next slide. So diabetes and cognitive decline. So we know that persons with type 2 diabetes are at greater risk of dementia. And that's really, concerning now, because we know that, obesity plays a role in the type 2 diabetes. And with the growing rates of obesity across the country, and especially here in Louisiana, where we rank 49th in terms of obesity. So there's also a strong correlation between Alzheimer's, dementia, and high glucose levels. And some studies have reported that the high glucose levels can also cause an increase in the amyloid plaques in the brain. Persons who develop type 2 diabetes have increased risk of dementia, and they're more likely to have the disease at a younger age. And this is also concerning too, because we know now that there are also increased incidences and prevalence of type 2 diabetes among children and younger adults. So person who have diabetes along with cardiovascular disease such as coronary heart disease and heart failure or stroke have an even greater risk. And persons with type 2 diabetes show accelerated cognitive decline. And studies have shown this to be specific in executive function and information processing. So this is just a little slide that shows us in terms of the Louisiana diabetes epidemic. Approximately 486,000 and more adults in Louisiana, or 13.8% of the adult population, have been diagnosed with diabetes. That's very concerning. And every year, an estimated 20,800 adults in Louisiana are diagnosed with diabetes. And then at the Louisiana obesity epidemic, we know that we rank, 49th overall in terms of obesity, but approximately 1,410,000 and 400,000 adults in Louisiana, or that's 40.1% of the adult population, have obesity. And we know that obesity is really a precursor for several chronic diseases that can also impact one's risk of cognitive decline and dementia. Next slide. So here are 12 dementia risk factors. And I have the reference on here for the Lancet Commission that really looked at dementia prevalence, looked at interventions and dementia care. It convened in 2017 and again in 2020. So these were 12 dementia risk factors that have been identified. And you can see their physical inactivity, smoking, excessive alcohol consumption, infrequent social contact, head injury, persons who are less educated, obesity, hypertension, diabetes, depression, and hearing impairment. And so in the 2017, there were actually 9 risk factors, but in the 2020 report, the 3 additional ones or newer ones that were added was the air pollution, excessive alcohol intake, and then the traumatic brain injury. So that being said, and this was also reported in the Alzheimer's in their 2023 report, assuming a causal link between these 12 dementia risk factors, as many as 40% of all cases of AD are attributable to these risk factors. So we can see in terms of, public health and then the role that we fulfill as healthcare providers, that these are some areas that we can, focus our interventions, especially the modifiable risk factors. And it will also require a degree of, in terms of tailoring the educational interventions so that they are age appropriate and they are culturally sensitive as well. So the nutrition, diet, and cognition, seeing food as medicine. And I'll just say about this in terms of the World Health Organization has recommended the Mediterranean style diet for cognitive and overall health because it is seen as one factor that may reduce the risk of cognitive decline or dementia. And then the American Heart Association, the U.S. government's dietary guidelines for Americans also emphasize diets that are plant-based foods such as fruits, vegetables, whole grain, nuts and seeds, low-fat dairy, fish, and lean meats. And then, of course, a limitation in red meats, sodium saturated fats. And we know recent research has come out about the highly processed foods and then limitation in sugars as well. Next slide. Exercise as medicine to prevent cognitive decline and dementia. Is it worth the sweat? And we know in terms of the recommended amount of physical activity, which would be 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise are an equivalent per week to maintain overall health and function, to reduce the risk and number of chronic disease, because we know that physical inactivity does play a role in many of the chronic diseases. But it says that particularly aerobic training has favorable effects on multiple outcomes, including reduced risk for cognitive decline and possibly Alzheimer's disease. So physical activity has also been included as a top priority in a recent review of the 12 non-pharmacological interventions with the potential to reduce the risk of cognitive decline and dementia. And this is also published by the World Health Organization. Next slide. Okay, so that's a glimpse of where we are in the state of Louisiana. And then I might say, in terms of the research that has been conducted to date, is that many of the studies have been in terms of observational, although longitudinal. Some studies have consisted of randomized controlled trials, but not many. So there's still work to be done in that area. But there are, some promising research that is underway at present that will hopefully give us some more scientific, empirical evidence to look at in the future. Questions?
Dr. Spurlock, I wanted to say that I've been looking at the risk factors, and they've actually added 2 more. Read that in the JAMA, and the most recent 2 risk factors are poor eyesight and a high LDL. So they're up to 14 now.
Yeah. Right. Okay. So with the sensory impairments, vision, hearing, and then some studies.
Of course, that makes sense, right? Just like the poor hearing, poor eyesight as well.
Most definitely. Most definitely. And
would you mind putting that reference in the chat, Gina?
Yeah, I actually have a chart someplace with it from JAMA.
Sorry, Wanda, I didn't.
It'll give me a while. Don't wait for me, you guys.
Yeah,
So
so I do have the reference for the one on the Lancet Commission, the 2020 report. That's on one of the slides with the
Yeah,
12.
that's great. That's great.
so I
And
just
we'll share it as well. We'll share the link in the post email as well.
Thank you. Terrific.
I just have a comment because I know part of our goal as not just the echo, but in thinking of what we can do to improve health in Louisiana. And I know in one of the earlier echoes, I believe I made reference to how childhood obesity in our state, and if you look particularly in rural areas, and it was based on the Bogalusa heart study, but just if you look at that, not that being overweight or obese is the root of all evil, but if you have that from such a young age, it
Right.
puts you at risk for all of those, the whole host of vascular disease. And you talk about cholesterol, inactivity, all those things that follow. So if there's one thing that we could target to educate our population at a younger age is, diet and exercise, I guess. But maybe you can comment more on that, because I know it's, those of us here, most of us are living in cities, but it's those rural areas, and how tragic it is, and how putting effort into that, hopefully it'll still take time, but that it seems like there is some improvement in people's understanding of how important diet and exercise are.
That's true, and oftentimes it's viewed as I guess, a complex, type of factor because diet, especially, it has such a cultural, basis to it in terms of oftentimes being embedded in a person's cultural background in terms of, dietary preferences and foods that they've eaten, across life. And then children, we educate children, but we have to also educate their parents because they are the ones more or less that are responsible, for, and they do provide the food in the home and, cook the food. So it's just really complex. But I know, even starting back in elementary school now, more emphasis is being placed on diet, nutrition, even in terms of, the types of foods that are now served in schools, the types of foods and drinks that are in, vending machines. It's just really a complex issue, but that's really where we have to focus our interventions, childhood and young adulthood.
So other questions or comments from anyone? So, I guess maybe I have another one, which is, if you just continue along the track of diet. And I know in some schools it's not a common thing, but in New Orleans, and I know when I lived in Kansas City for a few years, it's interesting when people look at community gardens and trying to do things to help people understand, growing fresh fruits and vegetables, especially vegetables. But I know in some schools here, there's been an effort, and I don't know if that's happening in other parts of the state, but wouldn't that be great if we could have an impact on that kind of thing? And it looks like Daryl has his hand raised. So did you have a question or a comment, Daryl?
Good afternoon. Yes, ma'am. I think one intervention that we can implement as well to collaborate with the education, whether school boards or the educators, to have that 150-minute time implemented into the school curriculum to where we reaching those targets for as physical activity. The dietary changes are already going forth, and we can start younger and making those interventions happen, and the younger populations to ward off some of those problems as they advance in age.
It's true. And I can remember, Daryl, even when I was in school, we had like several, research periods, a recess. And during those recess periods in elementary school, we would all be engaged in physical activity. We'd be running, jumping rope, those types of activities. But now I know that those, opportunities or outlets are even more, limited, even in elementary schools today. That there's really less, emphasis on exercise and physical activity.
Well, and even for learning, it's not good to sit for that long.
Right.
And, but, yes, go ahead. Daryl has another comment. Go ahead.
And I think another factor, especially in Louisiana, some of the challenges that we may have with, crime and violence in certain areas, parents may have a tendency to keep the kids inside more with, electronic engagement and not so much of outside because of the crime and the prevalence of, bad things happening in certain areas of our community. So I think the holistic perspective that we need to take, not only just as clinicians, as medical professionals, doing the research, looking at the data, seeing what's available, but also working with our policymakers and our educators to come up with a holistic solution that can, possibly turn the tide on this problem with dementia.
Mhm. Yeah, most definitely. When you said screen time, that rang a bell. Because where in the past, kids were outside, playing and engaged in physical activity. Now, more or less, we tend to see more children with the really increased, screen time. And that's really taken the place of a lot of physical activity in the past.
I know that Pennington Biomedical has they have a project where they're working and going out to the elementary schools to work with teachers to teach them about this, about the importance of exercise. And they are actually finding there are some schools that don't even have PE.
Right.
No,
Yeah, that was cut. I was going to say that my kids have just gone through the system. They were chopping PE like crazy. Any kind of organized.
Really?
Yeah. Yeah.
Can't imagine that.
Very limited.
I just wanted to add to along similar vein. And I think Mr. Davis touched on this, if I heard correctly, the environmental factors as well, crime and just the environments that folks who tend to have lots of those risk factors may have to live in. Sometimes it's not safe to get out there and be able to walk in your neighborhood, and not just crime, but also the conditions of the sidewalks and roads and those kind of things can sometimes, cause more problems than they help.
Right. Yeah, that concept referred to as a built community. But that does
Mhm.
oh,
So I think, when we look at those risk factors, and I know we're addressing things from medical, perspectives, it's a much, much large, we know this way larger and tons of other things that can go into it for individuals. I know my mom she does not have dementia, but she's elderly. My dad did. He passed away uh not from dementia, but from illnesses, associated with it. And my mom just found a council on aging near her house, which is great. But in order to get, like, she can't walk there because it's the, it would be too dangerous to walk down the road. So she would actually have to drive to get there, which is another, kind of another hurdle that we're trying to look for her to be able to participate in some of the things, because she will not go walk in her neighborhood by herself. Just also with people with animals and things like that you don't know if a dog may be off leash. There's all kinds of factors that I would not have thought of as
true.
a
And lack of sidewalks and all.
yes, as a younger, a person who doesn't really have to think through those things. But hearing it from her perspective has definitely opened my eyes up to a lot of other things to take into consideration.
So true.
I wanted to ask you all about, I was born and raised in California where the weather is really temperate. In the winter and the summer, you can just sort of go out and take a hike or walk. I mean, it's accessible because it's not 90 plus degrees and 90% humidity. I mean, that has changed my lifestyle a lot since moving here 10 years ago. And I don't know if I mean, Louisiana, the South is sort of unique for how hot and humid it is, and that's got to be a barrier too. It's dangerous.
Right. That is definitely a role, and especially for older adults, they're more prone to the heat, strokes and all. And there are just some periods of time that people will say they don't really, go out for walks and all because, like you said, it's just too hot.
Yeah.
And whereas some may use the mall, large malls for, indoor walks and activities. But I think some of this is definitely seasonal and based on the climate here in Louisiana.
Yeah, it's another barrier. I mean, getting to the mall, like getting to the Council on
Sure.
Aging. And, yeah.
Transportation and all that.
Okay, we're at 15 minutes to the hour, and we want to get through